this proposal has a lot of critics, but some are saying the criticism so far, I mean, it's not even in bill form yet, has been premature. Is there anything that you've been able to identify that's worth keeping in this?
Well, look, the problem with this CBO report on the impact of the Republican proposal, 24 million people losing their insurance, Josh. I think it's dead on arrival. It was a bad, bad bill from the start. I think there are things that we can do to improve the Affordable Care Act, and I voted for a number of them already, and I'm open to further improvements. But look, you can't pull the rug out from underneath these people, and particularly it couldn't come at a worse time in New Hampshire. I've been traveling around to our rural hospitals, Berlin, Lebanon, to Alice Peck Day over in Peterborough this week, and these are small hospitals serving their communities. They run at a very close margin, Josh, and if you pull out 10% of the people that finally got health insurance through the Affordable Care Act and pull the rug out from underneath them, those hospitals are really in danger. And in most places, those are the largest employer in the community, and I'm very concerned about the impact. So they've got to come back with something that's a lot more workable in order to get a bipartisan bill that makes it through the House and the Senate.
Unless there's a major change in the philosophical position of a lot of the Republicans who want to repeal Obamacare, it's going to come in the form of some block grants, basically a big bag of money that the federal government's going to give to the states to apply those dollars to how they see fit. And the criticism has been that it's not going to be enough. For those who don't understand, why isn't it enough?
Well, first of all, it doesn't start out being enough, but more importantly, as you go forward from year to year, the block grant doesn't grow by the amount of healthcare inflation, and so it doesn't keep up with the cost of healthcare. And then much more importantly, for a state like New Hampshire, the block grant is a fixed amount. Think of it as a capped amount per person in the Medicaid program. And the problem we have is that it doesn't respond to outside circumstances. Take, for example, this terrible opioid epidemic that's hit New Hampshire so hard. Or you could think of Zika or Ebola, something happening to the public health that needs a more vigorous response. And instead, the state of New Hampshire would just be left high and dry. And really, this is a big downshifting from the federal government to states and municipalities to try to take care of people in their community that suffer from illness or injury.
Yeah, and I'll point out that a number of Republicans in Congress, they're critics of this plan, this proposal so far. So let's talk about things that you believe do need to change under the Affordable Care Act in whatever form it's going to wind up becoming. A lot of Democrats have said it does need to be fixed. From your standpoint, where?
So here's the group of people that I'm focused on, Josh. I talk to people all around the state, particularly young families. These are young people in their 30s. They've now gotten past that age of 26 where they're off their parents' insurance. They're just getting started out in the economy. Maybe they've got 3 or 4 years under their belt. They're lucky to have health insurance, but the problem has been the premiums are too high and the copays and deductibles, the out-of-pocket expenses, are just too much. One of the whole purposes behind the Affordable Care Act was prevention, getting care in a timely way. And what I worry about is that these people are not getting the insurance they need, they're not getting the coverage they need, and therefore they're not getting the care that they need. And I'm particularly heartbroken of stories of young couples starting out. They can't afford to have a baby. What does that say about our society and our culture that we're not investing in these young families to stay and live and thrive right there in New Hampshire? So that's where I'm going to be focused. Let's bring down the premiums, bring down the cost of health care. And the way we do that is through investing in people's health and well-being, preventative care, and making sure that they're not just showing up at the emergency room with very expensive illnesses. So that's one step. Another step I want to tackle is the high cost of prescription medication. I think it was a big giveaway, and this was during the George Bush years when we added Medicare Part D and didn't negotiate the price of medication with the big pharmaceutical companies. So that's one I've talked about for several years. I think that could be a bipartisan approach, would really help to tackle that underlying cost of health care. And so these are some of the things. We also talk about something called the Cadillac tax. I want to make sure that hardworking families that have perhaps over the years not seen the pay raises they want, but maybe gotten better and better benefits, we shouldn't be penalizing these people for trying to take care of their families. And, the list goes on. There are a number of things that are bipartisan that we could be doing. But the main thing is let's provide access to coverage and bring down the cost. And interestingly, Josh, that's what President Trump said he wanted to do, but this proposal on Capitol Hill is not getting that job done.
So pointing to everything that you just said, Congresswoman, and I want to be very clear about this, a lot of the critics of Obamacare in the current form believe if it isn't changed in a variety of different ways, a lot of people believe in a wholesale way, it is going to fail. The model is just not going to be able to sustain itself. So let me ask you about the individual mandate, the requirement that people have insurance. Is there a model that you believe possible that could exist without the individual mandate and still be sustainable for the future?
Well, what's interesting, their new proposal actually, it has a mandate perhaps with a different name. It's going to hit these young people with a severe penalty, 30% cost of the insurance as a penalty if they go without coverage for a relatively short period of time. So that's as much as a mandate as I've seen. Look, maybe there are some other models, and I'm willing to open to it. The idea is that you want to get coverage for the maximum number of people, and so that everybody's in this together. They're getting the preventative care, they're getting care early, they're not showing up at the emergency room with some extreme condition that's very, very costly. And I think whatever we can do to get people into the system in a timely way, and look, let's focus on wellness. Let's address those 5 top cost drivers of diabetes, heart disease, high blood pressure, obesity. Let's make sure that we're helping people to stay well and stay healthy. There's a lot we can do with the tax code to incentivize that, get people to go get their exercise, to eat healthy, to get sleep and take care of themselves. I think there's other programs that we can do that can help people to stay well and be well, and frankly not need to rely on a system that was built for people when they're ill and injured.
We're just about out of time, Congresswoman, but let me ask you this. If we learned one thing in 2016 is that voters are frustrated with Congress and the status quo, is there a recognition, whether it's on the part of Democrats or Republicans, is there a collective recognition in Washington this time around that, you know what, progress has to be made, whether we're talking about the Affordable Care Act or anything else for that matter?
Absolutely. And I'm excited, Josh. I serve on the Veterans Affairs Committee. It's one of the very bipartisan committees. I sat down with Secretary Shulkin yesterday, the new secretary for the Trump administration. A lot of progress that we can make in a bipartisan way. I'm doing the bipartisan opioid task force, and I'm looking forward to the work that we've got going. 85 members of Congress, R's and D's, working together. And then lastly, next week, I'll be launching a bipartisan task force on sexual assault. And I was just talking with colleagues on the other side of the aisle that I will be working with, introducing legislation, and we'll be holding hearings on this issue about the Marines and the very unfortunate, what we call sextortion. It's harassment online of lewd photographs, and an unfortunate incident for the Marines, but something we need to get to the bottom to. So there are plenty of issues that we can be working together. That's always been my goal since I got to Congress. I disagree strenuously with the president, and I'd love to come back another day to talk about his budget because I'm very concerned about the cuts that are proposed. But look, we can always find work where we can find common ground, and that's what I've been sent there to do, and that's what I plan to get done.
There's only one consensus, Congresswoman, is there's a lot of work to get done. Thank you very much for joining us this morning. Good to see you.
Plenty to do, Josh. Plenty to do. Thanks so much. Great to be with you.
Okay. All right. Coming up after the break, we're going to talk with the newly minted candidate for mayor of the state's largest city, Joyce Craig. Stay with us.